Hello friends, there are two words which look similar and most of us will get confused between the causative factor of albinism and vitiligo. So albinism and vitiligo, both these patients will have almost white color skin, right? Vitiligo, there will be patchy hypopigmentation of the skin, or albinism, mostly you see the whole body of the baby will be white in color, will be depigmented. What is the difference between albinism and vitiligo? Albinism occurs due to the deficiency of the enzyme tyrosinase. Tyrosinase enzyme is a copper-based enzyme which is very important for the synthesis of melanin. See, tyrosin, in the presence of the enzyme tyrosinase, through a series of reactions forms pheomelanin and eumelanin, which are responsible for giving color to our skin, hair and eyes. But in albinism, there is deficiency of this tyrosinase, which will result in presence of milky white skin, and the patient has white colored hair and red eye color is seen due to this albinism. Whereas in vitiligo, the enzyme tyrosinase is actually normal. And here, what is the problem in vitiligo then? The problem in vitiligo is due to the lack of melanoblasts in certain regions of the body. See, normally melanoblasts are the precursors of the cells called melanocytes. These melanoblasts gives rise to melanin, produces melanin in the melanocyte. But because of this absence of this melanoblasts, there is no melanin production, thus there is no color, causing white colored either patchy areas or complete white colored skin or pale colored skin, or better in a medical terms we can say hypopigmented skin. So this is about the differences between albinism and vitiligo. Thank you guys for watching my lecture. Thank you.